All right. So everybody should be able to see a PowerPoint on your screens right now. If you cannot, speak now or forever hold your peace. All right, so just a little bit about myself. I am Kristen Malcolm. I'm one of our newer physical therapists here at ACAC. I joined the team just before COVID hit last January. So still getting to know a lot of people in the community, and this is a great way for me to be able to do that. I am a board certified orthopedic clinical specialist. I have my doctorate from the George Washington University in DC and my bachelor's in x-ray science from Elon University. I do dry needling as well as blood flow restriction training, and I do have about 15 plus years of Pilates experience. I do not have any teaching certifications but many of our therapists do. So that's a great thing that we're able to offer here at PT at ACAC is integrating Pilates into the management of all types of pain, but specifically lower back pain in this instance. So just to start a little bit with talking about what is lower back pain. So low back pain is actually the top cause of disability in the entire world. And 25% of Americans do report having lower back pain in the last 3 months. In most cases, low back pain is mild and it just goes away on its own. However, for some people, this back pain continues to nag, and that might be some of you guys. And this can lead to a decrease in a quality of life. Most people who have an episode of lower back pain have at least one recurrence throughout their lives. There's 3 main categories for low back pain: acute, which is less than 3 months; recurrent, where your acute symptoms continue to return; and chronic, which is pain lasting longer than 3 months. Causes can be unknown. It can be caused by degenerative disc disease, lumbar spinal stenosis, fractures, a herniated disc, osteoarthritis, osteoporosis, or most severely, tumors of the spine. However, research has shown that these conditions can also be present in people without pain. So a fairly recent study showed that 30% of 30-year-olds who don't have back pain actually do show some type of degeneration in their spines on MRI, and that goes up 10% every 10 years. So 70% of 70-year-olds who don't have low back pain have degeneration. So just because you do have some of these things on imaging doesn't necessarily mean that it has to be a whole chronic thing where you constantly are living in pain. So if you do have low back pain, what is the best thing you can do right now? You want to stay moving. Continue with your normal routine if possible. Research has shown that bed rest for more than 1 day can actually slow your recovery. So if your pain does persist more than a few days or it worsens, you can schedule an appointment to see your physical therapist. As physical therapists, we can do a lot to help with lower back pain. We can do manual therapy to help improve mobility of joints and soft tissues. We can provide education on body mechanics with training for proper lifting, bending, sitting, or even sleeping positions. We also can do modalities like ice, heat, or electrical stimulation that can help to relieve your pain. And more importantly, we can also provide you with exercises, specific strengthening and flexibility exercises to help manage your symptoms. And we can also help to create a safe physical activity program to help improve your overall health and manage your lower back pain. So to prevent low back pain, we always recommend using good mechanics and positioning at home, work, and during leisure activities. We have seen a lot of patients in the last 14 months who have developed low back pain from changes in their seating, going from working at desks in offices all day to a new desk setup at home, and maybe not being as ergonomically correct in their sitting versus how you were in your office. So things like that, making sure that everything is set up the way that it quote unquote should be is really important. When you are lifting, you want to keep the weight as close to your body as possible during heavy lifting. Physics tells us the further away something is from our center of gravity as we're lifting, the more pressure it's going to put on our bodies. So the closer it is, the easier it is to lift. Also, just going in line with today's topic, maintaining a regular physical fitness program is one of the best things that you can do to manage back pain and prevent it. Things to look out for that mean you do need to go to the ER or something a little bit more, something more than your physical therapist. If you have a loss of bowel or bladder control, if you have numbness in your groin or inner thigh, or a pain that does not change with position, it doesn't get better or worse with different positions, it's just constant, always at one time, one place. So there are many treatments for low back pain, many of which are listed here. However, the ones in green are the ones that are actually recommended by the American Physical Therapy Association. Those are movement, education, and cognitive behavioral therapy. Sometimes appropriate would be yoga, massage, acupuncture, or spinal manipulation. We really want to stay away from opioids, imaging scans, injections, surgery, and sometimes even heat. Heat can give you some short-term relief, but it's not necessarily going to give you something more long-term. And imaging scans, if we can avoid them, if there's no red flags, sometimes those will actually lead towards unnecessary treatments. For most back pain, surgery is not recommended. We always want to go with the more conservative options first. And that's what we recommend with movement, education, and cognitive behavioral therapy for chronic pain. So going into the Pilates side of things. Pilates was developed by Joseph Pilates and was originally called Controlology, which I think tells you a lot about what Pilates actually is. It's an exercise that consists of low impact flexibility and muscular and strength endurance movements with an emphasis on postural alignment, core strength, balance, and flexibility. It's a systematic practice of specific exercises coupled with focused breathing patterns. So breathing with Pilates is extremely important, and we'll go into a little bit more detail about that in a bit. There are many types of Pilates classes. You see them all around town. We have just regular mat classes where everything is performed just on a mat. And then there's also apparatus classes where there's more complex movements, more complex equipment involved, like a trapeze table, which sounds super fancy and like you're going to be swinging from the high ropes. Not exactly what you're going to be doing, but it's not far from it. A ladder barrel, a wounded chair, and a spine corrector. The most common classes that we do see around are reformer classes, which were originally developed by Joseph Pilates with the goal to address physical dysfunction or injury, as well as condition the body. So that those often fit really well hand in hand with physical therapy. The reformer is the machine you might have seen in the gym or in our clinics that many of my patients have likened to the stretching machine that they have in the movie The Princess Bride. Looks like you're going to be pulled apart at all edges by it. It's not nearly as scary as it is in that movie. So Joseph Pilates, the founder of Pilates, was a fitness and conditioning enthusiast born in Germany in 1883. His thinking was shaped by working with injured soldiers during World War I. So really, Pilates was developed out of treating injuries. He immigrated to the US in 1926, where he and his wife Clara taught a very small number of students in their New York City studio. Clara, his wife, incorporated Joseph's concepts into the treatment of more seriously injured or ill clients, while Joseph focused more on the healthy, active population. In the 1930s, Pilates developed a reputation for his ability to fix dancers' injuries, leading to George Balanchine, Martha Graham, and Hanya Holm both studying and referring injured dancers to him to help their dancers get back on stage. That's kind of when they started to realize that, hey, this could work to treat an injured population as well. So in the 1950s, Pilates worked with Dr. Henry Jordan, who's the chief orthopedics at Lenox Hill Hospital in New York, with hopes of seeing his work embraced by the medical community. Unfortunately, his efforts were largely unsuccessful, and Pilates became very upset with what he saw as the medical community's passive definition of normal health and a narrow vision of preventative medicine, as well as poor standards for proper physical conditioning. At that point, he just kind of was like, okay, medical community, I'll do this without you. In 1967, he passed away. And in the 1980s, several years after his death, Dr. James Garrick, the director of orthopedics at St. Francis Hospital in San Francisco, established the first medically affiliated Pilates program. And prominent orthopedists in New York City began referring patients to Pilates as a rehab. So unfortunately, in his lifetime, Pilates was never able to see his creation really embraced by the medical community, and we have come a long way with using it. And now physicians all over the country and all over the world do recognize its ability to help us and help use it in the rehab process. Joseph Pilates, a little full of himself. One of my favorite quotes by him was that, "I must be right, never an aspirin, never an injury a day in my life. The whole country, the whole world should be doing my exercises. They would be happier." He was a very healthy, very active, very fit man up until the day that he died. And he largely attributed that always to Pilates. The goals of Pilates to improve core stability, improve muscle control, improve strength, improve posture, and prevention and treatment of back pain. All of these things kind of do come together in order to prevent and treat back pain. With better core stability and muscle control, as well as strength and posture, we really can help to manage a lot of the things that contribute to developing pain in your lower back. I get a question a lot about why Pilates versus yoga. The short answer that I often give is that Pilates is more about stabilizing and lengthening, whereas yoga is more focused on the lengthening. There are obviously other differences as well. Yoga originated 5,000 years ago in India. It's been around forever and ever. Pilates originated about 100 years ago, so much newer. Yoga is really in its truest form. The goal is connecting the individual consciousness to a universal consciousness, leading to a creation of a spiritual enlightenment, with the goal of improving the physical, spiritual, mental, and emotional health of the practitioner. The emphasis is more on the mind, body, and spiritual connection with a focus on introspection. You really want to clear the mind and surrender to the movement, and you work on improving the flexibility and strength of the body through the asanas. Pilates, on the other hand, its goal is really to correct the dysfunction and improve movement, exactly what our goal as physical therapists often is with our patients. We work to improve posture and create a strong and balanced, stable base from which to move. As I mentioned before, it's very systematic, it's very disciplined, and its approach to physical movement is through focus and clarity of the mind. So rather than surrendering to the movement like we do in yoga, it's more about body awareness and understanding where you're putting yourself. There's constant attention on posture, alignment, and movement mechanics the entire time. So I think after all of that, you can kind of see how Pilates really can help with lower back pain. It works to improve the mobility of the spine through allowing each vertebrae to move in a more systematic manner, allowing one vertebrae at a time to go through. It also allows improved firing of the muscles that support the spine. The exercises also have a focus of improving stability of the core muscles. So working on the abdominals, working on the lumbar stabilizers, and working on the gluteals. All those muscles come together to provide support for the lower back. The research that's out there basically says that Pilates works in order to keep back pain away. It's effective in reducing pain and improving function as well as quality of life in patients with chronic non-specific low back pain. So patients that have back pain that lasts more than 3 months and you really can't say like, this is why, this is where, like just very generalized lower back pain. It's also effective for improving muscle resistance and strength, flexibility, postural balance, and pain with patients with a traumatic spondylolisthesis at L4, L5. So a more traumatic event with an actual mechanism of injury, much more specific. We're seeing positive outcomes for that. So controlology, as Joseph Pilates developed it, was really based on the concepts of centering, concentration, control, precision, breath, and flow. Centering allows for effective engagement of the deepest abdominal muscles, or the powerhouse is the term that is often used in Pilates. These muscles provide support to the spine and improve your posture. The concentration, as I mentioned before, we're really maintaining that mind-body connection and focusing on good form. It applies to the awareness of posture while sitting at your desk, or proper body mechanics while lifting a heavy object. As far as control, the control in Pilates comes in two different ways: muscle control and motor control. Muscle control is the strength and stabilization of the deep lower back and abdominal muscles that is developed by repeatedly challenging your body with the exercises. Motor control is more the refinement of the movement patterns as the connection between the brain and the muscles improves. So it allows you better control and support of the spine during functional activities, so that you're able to lift that box without having to stop and think every single time, is my core engaged? Am I bending the right way? It becomes more second nature to you through the activities in Pilates. Precision, also a huge part of Pilates. This allows for effective firing of the muscles, proper form, and concentration. I think this is one of the biggest things that Pilates is helpful for in working on core engagement, is that we often see patients, when you're told to engage your core, that you actually end up over-engaging. You're bringing in lots of other muscles into the activity, but with Pilates principles, you're able to better just engage smaller muscles, smaller muscle groups, and not just use the entire body to perform a movement. The breath in Pilates is used to better engage the powerhouse, and it also provides nutrients to the muscles. So as we're exhaling, we're sending the exhale to the muscles that we're trying to engage, which provides better blood flow to those muscles. More about the breathing in Pilates. The breathing that we use in Pilates is very diaphragmatic breathing. Comes from underneath your rib cage. You're not breathing up in your chest up here, and you're not breathing down in your belly. You breathe in through the nose and out through the mouth, with the goal of energizing and preparing the body for movement. We then coordinate the breath with the movements. So an inhale is oftentimes coupled with an extension, whereas the exhale is coupled with flexion, which is the abdominal engagement. So we inhale through our nose and exhale out through the mouth. And as we exhale out through the mouth, that's when we're engaging our abdominals. As always, if you haven't exercised for a long time or have health issues, it's recommended that you check with your doctor before starting any new exercise program. One of the greatest things about Pilates, it is super modifiable. You can do it with many different comorbidities. It's also great for women who are pregnant. There's lots of modifications you can make based off of where you are in life and where your body is. It's just those activities can be modified specifically, so check with a professional before you just go around modifying them. Okay, so now we're gonna go into just some basic Pilates-based exercises that we do use to help manage the lower back pain. And we're going to start with kind of a building block movement through. So start with the basis and then progress up towards a little bit higher level exercises to do. Okay, so we're going to start with just the basic pelvic tilt. Lay on your back with a neutral spine, knees bent, and feet flat on the floor. Inhale, and as you exhale, engage your abdominal muscles, as if someone was about to punch you in the stomach. You can also think about engaging your pelvic floor, as if you were in a meeting and needed to go to the bathroom. You're going to hold for a count of 10, and then relax. So I think the biggest thing with this one that we often see as a mistake that our patients make is that they're imprinting their spine into the mat. They're really trying to push their lower back into the mat. And that's not really what we're looking for. We're looking for a neutral spine. So I don't want to be able to stick my whole arm in between your lower back and whatever you're laying on, but being able to fit a soft hand underneath your lower back, just a nice natural curve. Not trying to force your back totally flat. Forcing your back totally flat is actually going to end up putting more pressure on your lower back and not create the activation that we're looking for with this one. Lie on your back with knees bent and feet flat on the mat, hip width apart. Place the arms by the sides with the palms facing down. Relax your neck, shoulders, and lower back. Inhale to prepare. Exhale to set the core, and slowly curl the pelvis and spine off the mat, one vertebrae at a time. Inhale at the top and hold the bridge. The pelvis should be at maximum posterior tilt, and a stretch should be in the hip flexors. Finally, exhale and slowly lower the trunk, rolling down one vertebrae at a time, returning to starting position. So this one I really like because it works on the stabilization, but it also really works on articulating the spine. So you're going through one vertebrae at a time all the way up and one vertebrae at a time all the way down in reverse. So like I mentioned before, this works on spinal mobility because you're encouraging each vertebrae to move in isolation on its way down. So lie on your back with knees bent, parallel legs, relaxed arms at the sides with your palms down in a neutral pelvis position. Exhale and raise one leg until the knee is above the hip joint and the thigh is perpendicular to the mat. Inhale and return to starting position by lowering the leg to the mat. Repeat the exercise 5 times with the same leg, placing the foot fully down on the mat each time. So I think you can see on this one, Maddie does a really good job. There's zero movement in her torso. It stays completely still the entire time. And that's really what we're looking for with this one. We don't want to see any wobbling side to side. The progression of this would be, rather than just doing 5 on the left and 5 on the right, is that you would alternate left, right, still really trying to keep that torso still and not letting the hips rock side to side. This is where it gets a little bit harder and we start bringing in some of the larger abdominal muscles. Lying on your back with the knees bent and the feet flat on the mat, hip width apart. Interlace your fingers behind your head and bend your elbows so that they point sideways. Slowly curl the head and upper trunk up so that the shoulder blades lift off the mat, and while the back portion of the waistline stays in contact with the mat. Inhale, drawing the abdominals in deeper at the height of the trunk is maintained, and pause. Exhale to lower the head and chest back down, starting position without releasing the abdominals. So that look on Maddie's face towards the end is because I don't think she realized how challenging that was actually going to be. That is actually a fairly hard one. That's once again, that's working on the articulation through the spine. So I would like to see that chin tuck first. So it's one vertebrae at a time coming up off the mat, and then the upper back, and then not lifting any higher than the bottom of the shoulder blades for that one. And that's going to bring in not only your transversus abdominis, which is the muscle that we worked in those early exercises, but also a little bit of your rectus abdominis or your 6-pack as well. Lying on your back with your knees bent, make sure your lumbar spine is pressing into the mat. Exhale and pull the abdominal wall in and perform a slight posterior pelvic tilt. Gently pull your inner thighs together. As you inhale, rotate the spine and move the pelvis, lowering the legs to one side. Exhale and rotate back to the center. Inhale and rotate the spine and move the pelvis, lowering the legs to the other side. Finally, exhale and return to the center. Okay, so this works more on the rotation mobility of your lower back. And then the progression that we're going to go to is actually going to work a little bit more on the stability of the rotation. The progression of this exercise is to perform with your legs in a tabletop position. So with your core engaged, lift your legs up so your knees are in line with your hip joints. Inhale and rotate the spine and move the pelvis, lowering the legs to one side. As you exhale, rotate back to the center. Inhale and rotate the spine and move to the pelvis, lowering the legs to the other side. Exhale and return to the starting position. So you can see that as Maddie went to the right that time, that left shoulder started to pop up off of the mat a little bit, and she pushed it back down. And that's because with this one, we really want to make sure that we're keeping our shoulders down on the mat so that you're working on that rotation more through your lower back rather than your upper back. Okay. Start in the up position of the pelvic curl. Exhale and lift one leg up into the tabletop position, moving only at the hip joint and keeping the pelvis level. Inhale and lower the leg to tap the mat. Repeat 5 times with one leg and then switch sides. Finish the exercise by placing both feet on the mat and rolling down one vertebrae at a time. So that one is actually fairly challenging because what you really want to do there is maintain your pelvis. So you can actually even put both hands on your hip bones, and you can make sure that your pelvis stays in alignment and one hand isn't higher than the other. So that way, if one hip is really dropping, that glute is really a little bit weaker on that side. And so you might need to drop down a little bit lower, or really, really, really think about squeezing your glutes as you're doing it. This is another one for articulation of the spine. Sit tall with the legs bent comfortably out in front of you and feet on the floor, hip bone distance apart, so that your pelvis has room to tilt forward. Your hands will be placed on the back of your thighs. As you exhale, scoop your belly and begin curving the spine, starting from the tailbone and rolling backwards until the arms are straight and the whole spine is curved into a C shape. You should feel as though the navel is the furthest point pulling you backwards. Hold there and inhale. Exhale and bring the body forward, keeping the C curve until the shoulders are over the hips, then stack the spine up to a straight, tall position. So for this one, I think for a lot of people, the hardest part is waiting to get out of that kind of curled hunch in the upper back. And as you can see, Maddie had a little bit of a hard time coming up through there because most people are really stiff in their upper backs because we all sit at computers all day and are all hunched over our phones all the time. So really trying to get to the point where you maintain that until everything is stacked and your shoulders are right on top of your hips, and then lifting your chest up out of that C curve. Kneel on all fours, making sure your wrists are under the shoulders, your knees are under your hips, and the spine is in neutral. While keeping your torso still and balanced, reach one arm forward and the opposite leg back, keeping the fingertips and toes on the ground. Lift the extended arm and leg off the ground, keeping the navel pulled into your spine to help stabilize the torso. Make sure you do not lean into your stabilizing arm. Hold for a few seconds before bringing the hand and leg back down to the start position. Repeat on the other side. So this exercise is a favorite of many physical therapists with Pilates backgrounds or not. This is similar to a bird dog exercise that is often prescribed to our patients. And the biggest thing with this one is you really want to make sure that you're not letting your lower back arch. You don't want to curve. And you also still want to keep those hips square. When in doubt, don't let your hips rock. So those are the exercises that I have for you guys today. Um, they are fairly basic, but of course, if any of them hurt, don't do it. That's my general rule. If it hurts, stop. And you want to make sure you're doing everything in a pain-free range of motion. So with the knee rocking side to side, if you can get 50% of the way there and it's pain-free, that's great. It's better to stay there than to get 100% of the way there and to have pain. So yeah, that is what I have for you guys today. If you have questions, there's my email and our phone number for our downtown clinic. I also do have a professional Instagram that you're welcome to follow. I'm not the best at it, but I occasionally am on there. I was just telling Angela.